Good afternoon, everyone. It is a great privilege and pleasure to join you today as we open what will hold the present and future of medical innovation and healthcare in the world. But the Global Center for Health Innovation is going to do more than just that. It will provide education and commerce, as well as showcasing the medical mecca that Northeast Ohio has become. It will be the one-stop shop for healthcare leaders from around the world to come, learn, and purchase state-of-the-art tools and technologies, some of which are produced right here in our own backyard. For more than 15 years, I have covered the medical scene in Northeast Ohio. I have watched this city become a world leader in research, biotechnology, and attract some of the greatest medical minds in the world. The center is the next step that once again sets us apart and will make us a sought-after city for medical conventions and research summits. It will provide a much-needed vaccine for Cleveland's economy, and I look forward to watching it evolve and bring you great stories of the science and patient-centered improvements that are happening right here and will literally change millions of lives.
But I want to recognize industry leaders such as Cardinal Health, Cisco, HIMSS, Johnson Control, Medtronic, Philips Healthcare, Steris, BioEnterprise, the Sisters of Charity, University Hospitals, the Cleveland Clinic, Metro Health, GE Healthcare Systems, Foundation Medical Partners. I'm skipping a lot, but I think you can tell just by that partial list that our aspirations for having the right partners involved, both public, private, and nonprofit, those aspirations were fulfilled.
I want to give special recognition to the county executive because Executive Fitzgerald, because he made sure that it was on time, ahead of time, on budget, state of the art, and that was programmed in a way that would better guarantee success of this facility for this region. So again, congratulations and thank you very much.
A global center for health innovation and a renovated convention center. The two spaces complement one another and enhance each other's features. They will be a worldwide calling card for Cuyahoga County, Cleveland, and all of our attractions. The reality has surpassed our expectations. The Global Center for Health Innovations is the finest medical showplace in the world. It is a symbol of where Northeast Ohio stands today and where we're going. It highlights our regional reputation for innovation and patient care. Every hospital and medical center in Northeast Ohio shares our pride today.
We are proud of our collective commitment to innovation and serving with the highest quality the healthcare needs of this community.
The Global Center parallels Metro Health's mission, and much of the success of the Global Center will be due to the impressive collaboration and teamwork that brings us together today to provide the innovation and the education that leads to improved healthcare delivery. Metro Health's presence here is a commitment to innovation in the healthcare delivery, focused on improving how providers, businesses, consumers, and the government interact to achieve better health, better experience, and better value.
This promise of invigoration is why we at University Hospitals are enthusiastic about the Global Center for Health Innovation. It will help to build Northeast Ohio's emerging brand as a global healthcare capital. University Hospitals is committed to leadership in saving lives and in improving Northeast Ohio's quality of life. And we welcome the Global Center for Health Innovation as we achieve the University Hospital's mission to heal, to teach, and to discover.
GE has a broad portfolio that has hardware, wetware, software, and service solutions. And what we'll look to do is look at how those technologies can improve the patient pathway through the continuum of care from screening, diagnostics, staging, therapy, and monitoring for each of those disease states. So for example, upstairs in our booth on the second floor for neurology, we'll highlight some of the work we're doing in Alzheimer's disease, and we'll show a PET CT and the way we can image the beta amyloid plaque that could be a precursor to dementia. We'll show a project that we're doing with the National Football League on traumatic brain injury and how advanced brain scanning can assist with that.
The folks taking care of your loved ones make a difference in their lives so they have solutions to help improve quality and productivity and safety of our loved ones and our family members. The Global Center has a very similar mission. They'll allow folks like us and GE and HIMSS to bring to life what we're trying to do so that people who come here can actually see what the future of healthcare looks like.
Here, all stakeholders will work together to test IT systems across the continuum of care to ensure health information can securely and under appropriate circumstances be exchanged electronically with patients, their caregivers, hospitals, clinical practices, retail clinics, pharmacies, payers, public health, and researchers. The simulation area that we are creating will be able to be accessed both physically here in the center and virtually, making the HIMSS Innovation Center truly global in scope. We are proud to be here. I personally am honored to be up on the stage with your civic and healthcare leaders who are making this dream come true today. Thank you very much.
That concludes this part of the program. Please, we invite you to go into the atrium for a reception, and also don't forget the tour begins at 3 o'clock, which is in just a few minutes. Thank you all for coming. Enjoy your tour and your day.
The Innovation Center here in Cleveland provides HIMSS the opportunity to continuously reach our audiences with the important matters related to functionality and interoperability of technology. We've got the presence year-round. We've got the information systems and the testing tools, technology, and other aspects necessary to validate whether or not a piece of technology works, who it works well with, what programming changes might need to be made for that technology to work better. And this doesn't exist currently. So that's the unique aspect of our Innovation Center here, is that we're able to do that year-round. Unlike before, we'd only do it maybe once or twice a year on a certain week, and that may not be when the products are ready, the companies are ready, or the issue's really relevant. The big issues in healthcare are cost, quality, and access. Technology is that tool which can help solve all of those in a fairly cost-effective way. It's not labor-intensive. It actually can reduce labor costs. It eliminates error. It reduces the redundancy of medical tests. And so what this does is, by being able to validate the tools that are right, the tools that are ready for implementation, therefore hospitals, physician practices will be ready faster to better serve patients, be able to serve more patients, be able to serve them more cost effectively and more safely. Getting rid of medical errors is a huge problem around the world, and technology is a way to work that human error out of the system. We've been talking about a permanent presence for the testing of information systems for 3-4 years, and we've looked at various options, and Cleveland became the only and most viable option for us. It's a presence that allows us to link up with hospital organizations, vendor companies, and others in the healthcare sector, all focused on this concept of innovation. So you've got a group of collaborators in this building that are coming together, addressing the same issue, improving healthcare, and using technology and innovation to do that.